Hey guys, how's it going? I'm Dr. Dan. This is Dr. Gary. We're here at City Facial Plastics in Manhattan. I'm here to get some Botox and show you guys what's so cool about Botox and how it's done. And Dr. Gary, do you want to say a little bit about Botox?
Yeah, absolutely. Hey everyone. So Botox is a great product for reducing the wrinkles on areas of the face. So today we're going to be focusing on the forehead here for Dr. Dan and really just trying to create a softer appearance of the forehead with these lines, but not trying to reduce his movement completely. So there's a way to balance those out with picking the right dose and the right areas to inject.
All right, let's do it.
So I'm in the process of drawing up some of the Jeuveau. So Jeuveau is a type of neuromodulator similar to Botox and Xeomin and Dysport, as you may have heard of. It behaves closer to Botox, and it even lasts a little bit longer, is what I'm finding in my practice. I'm using a 2-inch needle to get down. You can probably see right here. This is where the product lives. So I kind of stirred it a little bit. Now we're gonna pull up and draw up about 20 units, just a little bit more than 20 units, about 22 and a half, because there's gonna be some air bubbles that form. So that's perfect there. I'll set that aside, and obviously we don't inject with this big needle. It's scary. So we get rid of that. And before I switch over to the needle that we're gonna use, it's very important to get rid of air bubbles. So you can see here, there's an air bubble. So if I just put a needle on there and I start to inject, we're gonna be injecting some air, which is not good. It's not gonna hurt them, but it is gonna interfere with our dosage. So by doing this, I'm knocking the air bubbles up and out. I'm losing a little bit of product, but I'd rather lose product and be much more accurate with my injection. And the next thing I'm gonna do is actually prime the needle. So again, if I take this and I inject it, there's gonna be some air that comes out. So I have to push a little bit and just focus on the tip of that needle until you start to see product right there. And that's where I stopped. So even though I drew up closer to about 22 and a half units, what I have there is a perfect 20 units. We wipe the forehead here with an alcohol wipe to really just cleanse the area, make sure that it's primed for the injections. I like to use this white eyeliner to really mark out in advance where we're going to put the injections. I think it's very helpful instead of just seeing the line and going for it, because it's all about the musculature that's underneath, and what we're doing with the neuromodulator is we're stunning the muscle. So I need to figure out where the muscle starts and ends in order to do a good set of injections. So we start off on the sides here by figuring out where this frontalis muscle, which is the muscle that we're working on in order to soften these lines, where it starts and ends. Dr. Dan, bite down for me, bite down. There you go. So as he does that, you can see this is what's called the temporalis muscle, and it activates and it gets bigger. Bite down again. See right there. So I know that that's where the temporalis muscle ends and the frontalis muscle begins. Same thing on this side. With my injections, I want to get all the way lateral, all the way to the sides of this muscle in order to not allow the side of the eyebrow to flip up. Because you may have seen what's called a Spock look in some people, and it's because the injections are not going far enough to the sides, right? They stop around here. You're trying to paralyze the entire muscle to not allow the eyebrow to create funny shapes. So that's really important. The next thing is, in order for us not to drop his eyebrows by paralyzing the frontalis, I'm going to create a little bit of a distance here, usually about a centimeter at a minimum. But you kind of judge it on a person-to-person basis. So I'm not going to be treating below that line. That's the reason for that line. So next, I like to mark the center or the midline. It just keeps me organized as I begin the injections. There are a couple of veins. I'm going to try to avoid them so he doesn't get any bruising. That's going to be one area of injection. And I really kind of go across, mark out a couple of areas. And if you don't go high enough, what can happen is this area starts to get smoothed out and frozen, and then this top part, you'll see some muscle movement. So we don't want that. So it usually just takes a couple of spots there. So pretty much I'm done marking out the right side of the forehead. Now we're going to do the left side. And that's pretty much it for the markings there. So I'm going to enter here. See, he's doing great, and you see it kind of bleb up. and I stop. What I like to do is hold a little pressure because I don't want to have bruising later on. And I find that if you hold that pressure now, it saves you some discomfort and a headache later on. About 17 units on his forehead. We drew up more than that because this is the first time that we're injecting him. We don't know his dose yet, so we had enough to work with, and yet we didn't have to use all of it. So that's it. He's all done.
Alright guys, thanks for watching. We'll see how this looks in a few days. You guys should all check out Dr. Gary over here at City Facial Plastics. He is the absolute man. He knows what he's doing.
I think the injection went great today. You're a great sport. Thanks for coming in. I'll be seeing you in 2 weeks, and we'll see what the results look like. And occasionally, you know, when you inject someone for the first time, you need to do a little touch-up at 2 weeks, and that's okay. And then we figure out his dose, and it stays that way for subsequent visits.
Awesome. Thanks for watching, guys. We'll see you again soon.
See you.